evening and thank you for joining us. We are still in the middle of summer, but 5 months into the COVID-19 pandemic, some doctors also have an eye on the upcoming flu season. We're coming off a particularly rough flu season in New York State. There were more than 157,000 cases. That's up more than 46% over the previous year. Tonight, NIKKI DEMENTRI shows us why it might be tough to tell the difference between COVID-19 and the flu and the impact the seasonal illness could have on dealing with the pandemic.
The severity of every given flu season is difficult to predict.
And this upcoming flu season may be complicated as the pandemic continues. COVID and influenza symptoms are nearly identical. Infectious diseases expert Dr. Thomas Russo says the only real difference is the loss of taste and smell in COVID cases.
And therefore, testing will become very important in this setting.
Flu season typically lasts from October to April. New York saw its peak towards the beginning of February of this year. The first COVID case in the state wasn't identified until March.
I think it's best if we assume that we could have a bad flu year, and we want to take every protection possible to minimize the chances of a widespread outbreak here in Western New York.
Dr. Russo is optimistic that mask wearing, social distancing, and frequent hand washing will help curb the spread of influenza.
In fact, that's already been shown from a couple of studies in the Southern Hemisphere, which are just coming out of their flu season right now.
Lab testing, though, is a concern.
If they now have to do flu tests and COVID tests, that could affect the turnaround time on the COVID test.
Governor Andrew Cuomo announced $30 million for counties to use in order to increase contact tracing and prepare for flu vaccinations and tests.
Any advice for Western New Yorkers as we head into the flu season in the next couple weeks and as COVID continues?
This is the time where we have to really double down and be more rigorous than ever in terms of observing all of these public health measures.
The big takeaway, get your flu shot and get it early. Several pharmacy chains are already busy preparing for the upcoming season. And Wegmans is already contacting thousands of its pharmacy customers over the age of 65. NIKKI DEMENTRI, 7 Eyewitness News.